So I am going over a few of our models from respiratory. So this is the one of the larynx and the beginning of the trachea. So you can see that hyoid bone up here. This right here would be your thyroid cartilage. This one is your, there's your thyroid cartilage. Here is your cricoid cartilage, and then these are the tracheal cartilages. So remember, if I have an arrow pointing to this, I mean tracheal cartilage. If I've got a bracket covering many of them, then I mean trachea. So please remember that. Here is your epiglottis cartilage, and then here is that arytenoid cartilage right there, and then your corniculate. So that's that model. This model here, as we, that was squeaky. As we look here, right, if here are the external nares, your nostrils, right in there. This space is going to be your nasal vestibule. And then as we come through the nasal cavity, you have your nasal meatus here. So you're going to have your 3 nasal conches, right? Superior, middle, inferior. And then we get to back here is going to be the external or the internal nares. And we come back here into our nasopharynx. Okay, so here's our nasopharynx, and that's the pharyngeal tonsil. The oropharynx, where we're going to have the lingual tonsil and the palatine tonsil. And then we get back into here, and here's a cross section through the larynx. So there's the epiglottis, and this is going to be the false vocal cord. Remember, that's the superior one. So it's the vestibular fold. And then we have the vocal fold, or your true vocal cord, which is the inferior one. And then we are here in the larynx, and then we get down in here is going to be trachea. All right, and so you have the laryngopharynx right here, but once we get back here, that's esophagus, and that's for when we get to digestion. We get to digestion. We also have this model right here, where you can see that there we have, right, the pulmonary, right, artery, pulmonary vein branch. Here's the, here's the bronchial. There's that pulmonary vein branch. Then you have your terminal bronchioles, and then your respiratory bronchioles. And then here, this is going to be an opening to the alveolar duct. Each of these is an alveolus. And this whole thing that this little string is around is going to be an alveolar sac. And you can also see all of the capillaries, right, that are surrounding each one of these alveoli. And then, of course, you can see all of these arterioles and venules that would be taking blood to or from these capillaries. And then this is going to be your pleura right here. Okay, so those are the 3 models that I wanted to go over. We also have the lung model, but that's just like in the book where you have 3 lobes on one side, on the right lung, 2 lobes on the left lung, and that's going to affect the fissures that you have, the regions between each of those lobes. So make sure you know those. Okay, and that's it for respiratory that I'm going to cover on video.